Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center, reporting for the week of March 18th, 2024. Following an update on COVID, flu, and RSV, and norovirus, and some other viruses, I will touch on, is long COVID a thing, post-COVID versus post-flu, and a little bit on long COVID and behavioral health. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. COVID is still with us. It's still causing sickness, disability, and death, and there's still a lot we don't know. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Wastewater COVID-19 activity nationally is finally down to low. It was moderate last week and it's been high for a long time before that, so this is good to see. And hospitalizations are also trending down. We are just under 14,000 hospital admissions for the week ending March 9th, and this is the 9th week in a row that COVID hospitalizations have decreased. And this is the 5th week in a row that we are seeing declining COVID deaths. So this winter surge seems to have peaked at a little over 2,500 deaths per week, the week of January 13th, and it's been coming down since. So the week ending February 17th, we were at 1,259 deaths. This is still too many, but definitely glad to see all of these indicators heading down, and we know that we can bring this down even further by ensuring that those at risk of a severe outcome from an acute infection stay up to date on vaccination and also get timely access to outpatient treatment to prevent progression. And taking a look at variant proportions, JN1 was at 92.3% last time we reported. Now it's projected around 86.5%. Luckily, it seems to be getting displaced by its close relative here, JN.1.13. Hopefully, things will stay nice and boring here. RSV detections also continue to come down. There's still some out there, but definitely heading in the right direction. So hopefully, we are nearing the end of RSV season. And now taking a look at influenza in the United States. So over to the right, we can see that the bars there overall are coming down for the last 5 weeks or so. But we do have kind of an interesting phenomenon here. When we take a look at the percentage of influenza B, so that's the green line there that's kind of going up. And you can see that influenza A, which is the yellow line, that's kind of coming down. So influenza A and influenza B can have somewhat different patterns and peaks, which it appears is what's happening now, where it looks like the peak of influenza A, that yellow line, it's behind us, whereas influenza B is having some increased activity. Now, new hospitalizations are finally coming down after having been flat for a few weeks. And so far this flu season, there have been an estimated 320,000 hospitalizations and 20,000 deaths from flu. 116 of those were pediatric deaths. So we've still got COVID, which we hope to see continue to come down, but which, as I think we know, will continue to go up and down. We've got RSV coming down, hopefully. We're coming to the end of that season. Flu A also coming down. Some increases in influenza B. Also, depending on where you are, we're seeing increases in parainfluenza and human metapneumovirus going up in some places. Talked a little bit about that last week. And those are two other kind of usual respiratory pathogens. So none of this particularly is out of the ordinary. Flu and COVID are the ones where we have specific treatments if you're higher risk, so you should know if you're in that category now and stay prepared. And flu, COVID, and now RSV are the ones where we have vaccines at the tail end of flu and RSV season now, but worth making sure that you stay up to date on all of the vaccinations. We are additionally seeing some increases in norovirus and rotavirus going on. Again, depends where you are. The wastewater links in the post, some of them do show these other viruses, but these are basically stomach bugs. Norovirus is the number one cause in the United States of what you might hear people refer to as a stomach flu or a stomach bug. It's not the flu, it's not influenza, it's norovirus, and it's very contagious. And so it's usually the one that's the culprit for outbreaks, like on cruises or in daycares or classrooms. And since norovirus is a virus, not a bacteria, you do not take antibiotics for it. There's also no vaccine for it. And any treatment you would get would really be to reduce the symptoms like the nausea or the diarrhea, but they won't shorten the duration of the illness or get rid of the bug. It's just one of those things that has to pass. The main concern we have with norovirus is dehydration from the diarrhea and perhaps from vomiting as well. So staying hydrated is critical. This is something that we worry about mostly in the extremes of age, so babies and older folks. So we want to keep a close eye on them, especially to make sure that they stay hydrated. And if they're having a lot of diarrhea or if they can't keep anything down, they're not able to take enough liquids, they're showing signs of dehydration, like very dry mucous membranes, or if their level of consciousness is altered, they seem disoriented or anything like that, then probably IV fluids are in order. And so you would be seeking medical attention for that. Norovirus spreads through contaminated food, water, surfaces, and from person to person. But with a little bit of effort, we really can reduce the outbreaks of norovirus. Wash your hands thoroughly. Also, you got to wipe surfaces down with bleach solution. So sanitizers and sanitizing wipes and things like that are not going to be enough, and it's got to be a bleach solution or thorough hand washing. And this is obviously especially important if you run a daycare or a senior center, for example, to prevent outbreaks, but also important within the home, within the household, so you don't get everybody sick. If it's possible, avoiding preparing food for others while you're sick with this is a good idea. If you are consuming raw fruits or vegetables, you're going to want to rinse those very thoroughly. And you're going to want to cook your food thoroughly and also clean and disinfect your surfaces. And once again, wash your hands. Now I want to talk a little bit about long COVID. I was not quite planning to do a long COVID update just yet. I do them every few months, but there have been some headlines that I'd like to address because they bring up a couple of important issues. And these are the headlines I'm referring to. And when I tried to get past the headlines, unfortunately, I did not get very far. The articles are discussing a supposed study out of Queensland, Australia, that apparently surveyed adults who had a respiratory illness. And this study will apparently be presented next month at the European Congress of Clinical Microbiology and Infectious Disease in Barcelona, Spain. And interestingly enough, the press release announcing that this study will be presented next month was dropped on Long COVID Awareness Day. So just taking a moment to acknowledge those suffering from long COVID and to express our gratitude to the dedicated researchers out there who I know are working tirelessly on long COVID and hoping to find answers and treatments for people who are suffering. And we remain hopeful for better understanding and treatment very soon. So these headlines hit on Long COVID Awareness Day. I went looking. I was not able to locate even a preprint article. As a reminder, preprint means the article has not passed peer review, which is something that you must do in order to have a published scientific article. And this in and of itself has been one of those things that has been great on the one hand and terrible on the one hand, and that is during the pandemic, well, before the pandemic, we really didn't see much access to preprint articles. And this is this was a great blessing, especially in the beginning when there was so much going on and peer review takes time. And so it allowed people who were in the field to look at what other researchers were doing and get a more accelerated understanding, which was very, very important, especially early on. But in my opinion, this is also one of the reasons why so much chaos and confusion has been created about things related to COVID, because anyone could really look at these preprint articles and you would have journalists and others reporting on articles before they passed peer review as if they were credible or settled. And many of those articles will pass peer review. But the problem is when they don't pass peer review, the word is already out. And even if there is a retraction, which we've seen happen, we usually don't hear much about that. And so the damage is kind of already done. So I'm not saying this is going to happen with this study, but we don't even have a preprint yet. And the fact that it made headlines like this, and we don't even have so much as a preprint article, just a press release saying that the findings will be presented at a conference next month, this suggests a potential agenda. The fact that it was announced on Long COVID Awareness Day is also understandably raising some eyebrows. And there was some confusion even in the lay press where this title had to be amended to clarify that it was the Queensland Chief Health Officer's conclusion that the use of the term long COVID should stop rather than it being a finding contained in this study. So much like the measles situation we talked about in Florida, we have a health leader that appears to be putting information out through the media that is not consistent with the literature. So that would make it appear to be political or agenda driven. Now, if they have done a study that somehow concludes that long COVID doesn't exist or that it's really something else, then they should provide that evidence. So if and when this study comes out, I will review it. What I will say is that it seems as though there are a few points that are trying to be made here, telegraphed through the media and the articles and the interviews that were done about this. And the first seems to be that long COVID somehow isn't a thing because there are also consequences you can have after the flu. And the second is that long COVID somehow isn't a thing because it's really anxiety or depression or some other behavioral health challenge. So I'm going to try to go through this a little bit, but let's say that there are studies that could be designed to help unpack and answer these questions. And in fact, there are already some quality studies. I believe we're just now beginning to scratch the surface of this, and there will be much more to learn as we go. But there's quite a lot of evidence that is everything from looking back, retrospective studies, looking at health records, looking at MRIs, looking at functional issues. And I've gone over some of these in the past and will continue to go over them in the future. This article that is going to be presented was kind of a survey. Don't know much about it, so I'm not going to say anything more about it now. But just to say that we really do need to do our best to look at the totality of evidence and definitely not stop at the headlines. So first, as it relates to this post-flu issue. So first off, I think it is actually great that we are finally recognizing that there are a whole host of post-viral chronic conditions that occur in some subset of people. And we really need to understand what subset that is and what we can do about it. And these are a subset of people who, frankly, have probably been brushed off for too long. Not just flu, not just COVID, other viruses as well. But I think the real take-home lesson here is that we have underappreciated the fact that there are post-viral chronic conditions for a very long time. And this is one of the things that we are hopefully learning. So instead of saying, well, long COVID is no big deal because there's also long flu, we should be saying, oh my goodness, we didn't really realize or appreciate the extent of post-influenza issues, and we now have an opportunity to do better. So what is the extent of this? Well, there are a couple of articles that start to help shine some light on this question. So First off, I think it's important to say that post-acute infection syndromes can encompass chronic illnesses that occur after not only viral infections, could be bacterial infections, could be parasitic infections, and how often or what is the prevalence of these post-acute infection syndromes is different between different pathogens. And we're just getting started with SARS-CoV-2, so we're still figuring it out. And as we know, flu and COVID are both contagious illnesses that are spread by the respiratory route. And we do know that after COVID, as well as after flu, some subset of people still experience various symptoms months after their acute infection. And these symptoms include everything from abnormal breathing, persistent respiratory symptoms, which we talked about a lot last week, fatigue, pain, anxiety, and so on. And we're not certain about the percentage. It seems to vary as it relates to post-COVID or long COVID. It seems to vary depending on probably which strain you caught, whether you were vaccinated, and so on. An area, again, where we have so much more to learn. But we've seen estimates ranging from about 10 to 20%. And estimates for seasonal influenza are considerably lower than that. So let's kind of dig in. I first wanted to review this study, comparison of post-acute sequelae following hospitalization for COVID-19 and influenza, which investigates post-COVID conditions, as well as the longer-term risk of emergency department visits, hospitalizations, and deaths in patients with COVID-19, and they compared their risk with the risk of patients with influenza. So this was a retrospective study, so looking back based on the TriNetX database, which is a global health research network. And they looked at patients with COVID and patients with flu who were hospitalized between January 2022 and January 2023. And they compared the risk of developing any post-COVID conditions. And as I said, also ED visits, hospitalizations, and deaths in both populations during 90 to 180 day follow-up, so 3 to 6 month follow-up. They ended up whittling it down to 6,614 patients in each group, and found ultimately that the COVID group had a higher incidence of post-COVID conditions compared to the influenza group, 18% in the COVID group, 13% in the flu group. There was also a difference in what each group was experiencing. So the COVID group had more abnormal breathing, more abdominal issues, more fatigue, more cognitive issues. And you can kind of see it laid out here on the graph where the dark blue is the COVID and that peach color is influenza. So basically every category here, we're seeing more issues in the post-acute period for COVID compared to flu. And then looking lower down, this includes emergency department hospitalization and death. And so really everything is increased in the COVID group compared to the flu group. And of course, they acknowledge that more research is needed to confirm the effects of post-flu. I don't know if we're going to call it long flu. I don't know what we're going to call it, but I don't think we should try to be taking away names. I think we need to be trying to add names as we add and increase our understanding, because I think that's right. We need to be examining all of this. The next study I wanted to talk about looked at long-term outcomes following hospital admissions for COVID-19 versus seasonal influenza. This was a cohort study. This looked at previous comparative analysis of people who were admitted to the hospital for COVID versus influenza up to 6 months following infection. And then they aimed to compare basically the acute and the long-term risk and burdens of health outcomes following hospital admission for COVID or flu. And they used the database of the U.S. Department of Veterans Affairs, and they analyzed data from over 81,000 participants admitted to hospitals between March 2020 and June 2022. They also looked at close to 11,000 participants who were admitted to hospitals for influenza between October of 2015 and February of 2019. So different time periods. And that is the beauty of having a database like the U.S. Veterans Affairs database. And participants were followed for up to 18 months to evaluate the risks and burdens of death and of a pre-specified set of health outcomes. They looked at 10 organ systems and the overall burden across all the organ systems. They looked at hospital readmission and admission to ICU. And what they found was, we already know this, the COVID group has a higher risk of mortality compared to the flu group. When they looked at the various organ systems, they found that COVID had a higher risk across all organ systems except the pulmonary system, which was higher in the seasonal influenza group. This is important. This is something we need to look at. This makes sense because we know that the flu, influenza kind of attacks the respiratory epithelium. So we know that that's in the respiratory tract and in the lungs, whereas SARS-CoV-2 affects the ACE receptors, which are everywhere in the body and on all the different organs. And so it can really affect all organs. So we know that. We've been seeing that since the beginning, but this kind of helps to confirm that. COVID-19 group also had an increased risk of hospital readmission, as well as admissions to the ICU compared with flu. So hospital admission for the COVID group was associated with higher long-term risks in nearly every single organ system, except the pulmonary system, and greater health loss than seasonal influenza. So really, I think this speaks to both groups require prevention strategies, intervention strategies. We want to keep people from getting so sick that they have to be admitted to the hospital. And we need to be paying attention to the long-term health impacts from both influenza and COVID. So I want to acknowledge a few things here. First, we're talking about people who are hospitalized in these studies, so that may not generalize to the whole population. We're seeing so much more COVID infection than flu that, of course, the burden, even if the percentages were the same, which they're not, we've just talked about that it's worse with COVID, but even if they were the same, the number, the volume, the magnitude is so much more huge with COVID. So the impact on the health system is going to be bigger. The number of people who are affected is going to be much bigger. But also the impacts on different organ systems are worse with COVID. And so we need more research to help us sort all of this out. But also acknowledging that we have a much shorter time frame that we've been dealing with SARS-CoV-2. So hopefully we will see things continue to get better. We know that we're still in an evolving situation with SARS-CoV-2, much more so than flu, where we pretty much, for the most part, have a good handle on flu. But we're still learning. So I think we should all be pretty humbled by all of this, that there's still a lot we don't know, and there's still a lot to learn. And as for the second point that I see is trying to be made through some of these articles and headlines, is that somehow long COVID isn't a thing because it's behavioral or it's some anxiety or some other issue. So I'm not going to have time to do a comprehensive review today on behavioral health and behavioral health as it relates to the pandemic, but I will be doing so in the coming weeks because there's actually a lot to unpack, and we're also in the very early stages of understanding that. But I did want to make just a few comments because of how damaging I think these headlines are, especially because most people are not reading past the headlines, unfortunately. But first off, before the pandemic even hit, behavioral health challenges were at the top of our list of escalating community health issues that we were facing, and something that we were constantly working on. And when the pandemic hit, those challenges escalated pretty dramatically. People who are already grappling with behavioral health challenges like anxiety or post-traumatic stress disorder, started reporting increases in their symptoms as a result of what was really a scary time for everyone. People who never had any behavioral health issues began displaying symptoms of anxiety and other issues. And as we reported early on, people who were, for example, in substance use recovery were relapsing. People who never had issues with substance use before began experiencing those challenges as time went on. Um, Many of us lost loved ones due to COVID. Children lost parents. People lost time in their life by being hospitalized, going to ICU, being on a ventilator, all of the trauma that's associated with that. People lost their jobs. People got behind on their educational goals. Some people felt very isolated, being isolated at home. Others felt very vulnerable going out and having to work as essential workers or being on public transportation at the height of all of this. So I don't think there's anyone who has not been affected by this ordeal. And obviously, depending on what age and stage of life you're in, I think we're going to continue learning about how this affected babies, young ones, elementary, middle, high school, college, adults, elders. We're still in it in a lot of ways. And in a lot of ways, I don't think we've truly grappled with all that this has entailed for the world. And now we have millions of people suffering with the lasting impacts of the infection itself. Some of those impacts are cardiovascular, respiratory, diabetes, and others. And having a new chronic illness itself is known to cause stress and even depression or anxiety. This is understandable. But also, some of the COVID impacts and post COVID impacts are neurological. They can affect the brain. We've seen MRI changes, we've seen functional changes, psychological changes. We still have a lot more to learn about that. So we will do a deeper dive on this in the future. But more than one thing can be true at once. We can have post COVID and we can have post flu impacts. We can have long COVID and we can have behavioral health issues that it is imperative that we as a society address. So all of these things can be true, and I believe all of these things are true. And I think it is really incumbent upon us to not be dismissing things, especially things that we don't understand. And we all need to, I think, stay humble in the face of some serious challenges that we continue to face. So in the meantime, let's do what we can to prevent the spread of respiratory illnesses, to prevent sickness and disability. We should stay up on our vaccinations, wear a high quality filtration mask when you are especially gathering indoors with others. Gather outside as much as you can. This is almost always safer than indoors. Make sure that when you are indoors, you're optimizing your ventilation and filtration. You can monitor the indoor air quality to do that. And then we're going to want to strategically use those tests to make sure that we're accessing timely treatment if we're someone who should be treated, that we're preventing the spread to others if we ourselves are positive. And if we are, then we're going to want to isolate, and we're going to want to test out of isolation, because enough virus to detect is enough to infect. And alongside all of those practices, let's prioritize eating a balanced diet with fresh foods, avoiding processed foods and sugary drinks, incorporate regular physical activity into your routine. Unless you're not feeling well, in that case, please prioritize your rest. Let's avoid infection and reinfection. Catching COVID once and doing fine is not a guarantee about the next time. And every infection is a new opportunity, perhaps even a compounded opportunity for long COVID and post-COVID impacts. And if you do not have a primary care provider, please get one. Don't wait until you need one to try to find one. Know how to reach them before you need them. Get your blood pressure and those baselines labs checked, like sugar and cholesterol. Establish a relationship with your primary care provider. We all deserve to have that healthcare provider who knows us and who is in our corner. And let's please do what we can to manage those stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.